Unexplained infertility, what it really means and what to do next. Your doctor told you everything looks normal, but you are still not pregnant. That is not a dead end. It is actually a very specific diagnosis and it has a step-by-step treatment path. That is what this video is about. I'm Dr. Handan Namli, an obstetric gynecology and fertility specialist with 25 years of experience. I help you understand your fertility step by step so you can make your next decision with clarity, not confusion. If you want to go deeper with full lessons, worksheets, and live Q&A, I teach inside a community called Fertility Master Circle. The link is in the description. And for this specific module, there is a free worksheet you can download. I'll mention it again at the end. Unexplained infertility does not mean nothing is wrong. That is the single most important thing I want you to take away from this video. Unexplained infertility is a medical diagnosis with a specific definition. It means you tried for the required time, you completed all the standard fertility tests, and those tests came back normal, but pregnancy did not happen. The key word there is standard, because the standard test we have today cannot detect everything. Some biological causes of infertility are real, but they are not visible on routine testing. What might be happening underneath a normal result? Egg quality issues, specifically chromosomal problems in the embryo that increase with age. Subtle sperm function problems that do not show up on a standard semen analysis. Fertilization or early embryo development failures that only become visible if you go through IVF. A short fertile window or poor timing. Mild endometriosis that has not yet caused visible structural changes. Or a combination of small factors that individually would not cause infertility but together reduce the monthly chance of pregnancy significantly. None of these are your fault. Unexplained infertility is a limitation of our diagnostic tool, not a judgment about you. In a moment, I'll walk you through the tests that need to happen before this diagnosis is accurate, because one of them is always timed incorrectly. Who get this diagnosis and when to start? Unexplained infertility affects more people than most realize. Together with combined infertility, these diagnoses account for roughly 40% of all couples seeking fertility care. You are not alone in this, and you are not in unusual situation. So, when should you actually start the evaluation? If you are under 35, 12 months of trying. If you are between 35 and 39, after 6 months. If you are 40 or older, do not wait. Start the evaluation now. And start earlier than these timelines if you have irregular cycles, a history of pelvic infection or surgery, known endometriosis, or a previous abnormal semen analysis. Those are signals that something needs attention sooner. The test that must be done correctly. Unexplained infertility is a diagnosis of exclusion. That means it is only accurate if the right tests were done and done correctly. Let me tell you what those tests are and where they often go wrong. For the male partner, a semen analysis interpreted against WHO 2021 reference values. If the result is borderline, repeat it before making any major decision. For the female partner, first confirmation of ovulation. This is usually progesterone, but there is where I see the most common mistake. A day 21 progesterone test is only valid if you ovulated around day 14. If your cycle is 32, 35, you probably ovulated around day 18 or 21. A day 21 test in that situation may simply be too early and give a falsely low result. If your progesterone result came back low, the first question to ask to your doctor is, was this test timed correctly to my cycle length? Continuing from there, AMH and intrafollicular count for ovarian reserve. These are planning tools, not standalone fertility scores. A pelvic ultrasound to assess the uterus and ovaries, and a tubal test, either an HSG test or histosonography to confirm the tubes are open. If all these tests are normal and pregnancy has not happened, then unexplained infertility is the appropriate diagnosis. The test you probably do not need. Before we go to treatment, one more thing. Many couples in this situation are offered a long list of additional tests: immune panels, thrombophilia screens, natural killer cells, or vitamin tests. Here is what the current ESHRE 2023 guidelines says clearly. These are not recommended as routine for unexplained infertility. They add cost, they add anxiety, and for the most couple, they do not change the treatment plan. Every time a new test is suggested, ask one simple question: how will this result actually change what we do next? If there is no clear answer to that question, you have your answer. Now, let's talk about treatment. And there is one piece of recent evidence that surprises a lot of people about IVF versus IUI, intrauterine insemination. I'll show you that in a moment. Step-by-step treatment path. There is no single treatment plan for every couple with unexplained infertility. Your plan depends on your age, how long have you been trying, and your test result. But here's the step-by-step path that current guidelines support. Step 1. Expectant management. For younger couples with a shorter history of infertility and a good prognosis, a time-limited period of optimized natural trying is a reasonable starting point. Aim for intercourse every 1-2 days in the fertile window. Use LH strips to confirm timing if your cycles are regular. The important word there is time limited. You give this a clear deadline. You do not wait indefinitely. Age and time are real variables in fertility and they matter. Step 2. Stimulated intrauterine insemination. For most couples with unexplained infertility, the first active treatment supported by evidence is intrauterine insemination combined with ovarian stimulation. The goal is to develop 1 or 2 follicles, not more. This keeps the risk of multiple pregnancy low. Both ESHRE 2023 and ASRM 2020 guidelines support stimulated IUI as first-line treatment. Now, here's the piece of evidence I mentioned. A 2024 individual participant data meta-analysis published in Human Reproductive Update compared cumulative live birth rates between IVF and stimulated IUI in unexplained infertility using the same follow-up time for both groups. The result: 50% live birth rate with IVF versus 43% with stimulated IUI. No statistically significant difference. What this means in practice: for many couples with unexplained infertility, completing IUI cycles first does not reduce your overall chance of pregnancy compared to going directly IVF when the same amount of time is considered. That is an important thing to know before making a decision under pressure. Step 3. IVF. IVF becomes the appropriate next step when IUI cycles have not worked, when age is increasing, or when time pressure is significant. One note on ICSI, cytoplasmic sperm injection. If your semen analysis is normal, current guidelines recommend standard IVF, not routine cytoplasmic sperm injection. I created a free worksheet for this module. It includes an evaluation checklist, a treatment path tracker, and the questions to bring to your next appointment. Download it using the link below. It takes 1 minute and it will organize everything we just covered. If you want to go step by step through all of this, Fertility Master Circle on School is where the full lessons, worksheets, and Q&A session live. You will have access to the complete curriculum, not just one video at a time. The link is in the description. You do not have to figure this out alone. My question for you this week: were you told your infertility is unexplained? And which part of this video felt most relevant to where you are right now? Leave your answer below. I read every comment. Take good care of yourself. I will see you in the next lesson.